Can y'all hear? Like, yeah, I think.
I'm sure he does.
Daily to.
There's more kids in his city. I don't know.
I think so. Hit the mic at the.
I don't have my glasses.
Oh, her messenger. I'll call her.
I'll share her.
Yeah, he can sit there like graduate.
Jeff's graduating, son a senior.
I just showed her a
They
message.
decided to go with it to watch.
Jeff's in homecoming this Friday night. So, football.
Yeah. Sad. Guys, that's sad. This is his first year. That was me, what was it?
Someone cheering?
Yeah, this year. I was thinking staying to the forward.
Cool.
In the parking lot eating, she'll be here. Very long. Can y'all see? Yeah.
Yes.
Yes. Oh, it's fun.
Do you have?
I lost it.
I got one flying around right now.
I love your shirt.
But I don't, but I don't know if you might be something to keep her.
Nobody else on it.
It's separate. Green. But I was thinking with you. But she has to live. It's always better to tomorrow.
A little bit. Yeah, anybody get work with them.
You moved them out and home and you lose brain cells about that.
Let's circle back.
That's my alma mater, so I get it.
I've been working less hard. I've kind of used the brain a little bit.
Yeah, she's. There's a problem.
Hey, I can leave.
I didn't find anything.
We're running to do fast. Okay. What's it saying? Okay, yeah, it's just not access. Oh, so that's good.
So it's all from now.
Yes.
Anybody else have this?
Okay.
When she gets in here.
I'll leave them.
There she is.
Say, she pulled me out of the girl, eat my burrito in the parking lot.
Yeah.
Okay, all right. All right, see you in 1 minute.
We flip.
Hey, y'all hear me?
Yeah.
Girl in the pink.
And where's Alice?
What's your first name and last name?
Me,
Yeah, you.
Whitney Jarvis.
Oh, I was like, who is that? Thank you.
Did anybody hear from this?
Okay, there was something important, not.
No, probably like.
Blondie, yellow shirt.
Yeah.
Yeah.
Big Apple.
Huh?
What?
What's your name?
Faith Avila.
Thank you.
Know your last name.
Avila.
Call her. She did not answer. Oh, it's still my.
All right. White sweater.
Sarah Plessig.
Huh?
Sarah Plessig.
Spell your last name.
ALESSIG.
No.
Spell it again, slower.
ALESSIG.
I guess not.
Right, check in front of you, Hurt.
Lillian Haydock.
Spell your last name.
HEJDAK.
H-E-J what?
DAK.
Alright. There's one next to you.
Victoria James.
James.
Yeah.
Behind you.
Eva Owens.
Okay. We have to have a sign-in sheet in the mornings, okay? When you come here on Thursday, you'll be able to do it yourself. Just give me 1 second.
Nicole, did you dye your hair again?
Sign below there.
I did backwards.
Sorry,
I called
we're
the.
not gonna love you no less.
Nicole.
Laryngitis. Inflammation of the vocal cords.
It is inflammation, I'll tell you that much.
Yeah, I'm pretty sure larynx is vocal cords, or at least, cartilage.
Yeah, it was on this table whenever we got these.
I'm good, thank you though.
What?
You want some salt?
Nope, I'm not that salty. Sorry, dad jokes for days.
Thank you. I'll keep it right here.
Yeah. Dang, there's a lot of key terms in this thing.
You know, I have a whole pack of note cards that you buy at Walmart, and I didn't even go through half of them.
I just started writing all my stuff down on my iPad because it takes up less paper than in a notebook.
Well, yeah, this is the one, I've not even written all the definitions. This is the one I have for just this chapter, and I'm not even halfway done.
I also did my nails.
I'm also getting a tattoo, don't mind me, I'm not having a midlife crisis at all.
Voice box, I was right.
Voice box.
Yes,
What?
larynx,
Oh.
larynx is the medical term for voice box, it's inflammation.
I thought of like your voice box for your phone.
No, so, yeah, so laryngitis, inflammation of your vocal cords or your voice box, so,
Where are your vocal cords?
right here in the trachea.
What's that called?
Your, it's the cartilage of that weird C word.
Choreographer.
Right here, the cricoid,
Cricoid.
cricoid, yeah.
It was
cricoid.
like something.
Cricoid cartilage.
Crank, like the crank kind of thing, crank.
Crico. Cricothyroid.
Cricoid.
Okay.
It's right here, yeah. I'm going over it now, yeah, because it was talking about.
Not bad for a whole guy, but
That's what I thought when I took the pretest. I was rusty on it.
well, that wasn't bad for a whole guy.
Got a decent grade on it. I was like,
Chapter 7, the dreaded A&P, the medical terminology. Are y'all ready for all this?
Yeah. I passed my term with a 92.
well, it's more than just my term. There's a lot more than just my terms.
I know.
Anatomical terms, body systems, and medical terminology. You're gonna love this. You got your plastic fork so you can stab yourself in the eyeball with?
I'm gonna warn you to slow down a lot probably, if I can. I'll let you know that now. I write fast too.
Okay. EMTs Kevin and Tom have just arrived on the scene of a patient with multiple stab wounds. Law enforcement has secured the scene, allowing Kevin and Tom to approach the patient, a man in his 20s. Kevin noticed immediately that the patient appears to be unresponsive, pale skin, his shirt and the upper portion of his pants are saturated with blood, and blood has started to pool on the floor around the patient. Tom reports the patient has a weak carotid pulse and begins managing the patient's airway and ventilation. Taking one of the patient's clothing to determine where he has been stabbed. Kevin sees 2 stab wounds to the left side of the chest and a stab wound to the upper right abdomen. What's in the upper right abdomen?
You got your liver, you got your pancreas, you've got your
There you go.
pancreas.
So what
Yeah.
could have possibly been stabbed?
Liver, your pancreas. Got your gallbladder.
Stab wound to the right groin and several cuts on the forearms and hands. What organs may have been injured by the stab wounds?
Liver, pancreas, gallbladder, kidney.
Okay, what else? Got stabbed in the groin.
Yeah, you got
What's down there?
testicles. Got the testicles, you got the ureter.
Easy, anything like that?
Yeah, you got the femoral artery.
Yeah.
Slap a tourniquet on that, if you can.
What's the consequences of injury to each of these organs?
You can bleed out. Extreme,
Bleed to death,
yeah, extreme blood loss.
which causes what?
Shock.
Hypovolemia.
Yeah.
Which causes what? What'd you just say?
Shock.
There you go. So are you in compensated shock or at this time or decompensated?
Or compensate.
Compensated. What terms will Kevin use to describe the exact location of each wound? Anatomical terms?
The one in the upper right is distal to the midline.
Okay.
Um,
You got stab wound in the upper right quadrant, which includes your liver.
yeah, so distal to the midline, stab wounds in the right groin.
Yeah.
Again, distal to the navel and distal and lateral.
Yeah.
Anterior to several cuts on the forearms and hand. So I would say distal to the palm. And hands,
Yeah.
hands. No, there's it's Palmer. Palmer.
All right. Good. Anatomy refers to how the body is made. Parts, right? Physiology is how they work. Medical terminology allows for concise communication. Anatomical position, standing, facing forward, arms at sides, palms forward. Positions, supine is what?
It's when you're,
On your back.
yeah,
Prone,
when you're on your belly,
on your stomach. Lateral recumbent.
you're standing.
You're
Left or
either
right side?
Left or right, laying on your side. Fowlers, you're sitting what? Straight up. Semi-fowlers,
Over but sitting down.
oh, you're left, not all the way up.
Get no more than 45 degrees.
Trendelenburg,
That's when your feet are elevated above your head.
okay. What is the shock position?
You're laying down with your legs up 90 degrees.
There you go. Sure it's 90.
Yes. And you don't practice the Trendelenburg or the shock position anymore.
Okay, there's what it looks like. Supine, prone, right lateral, left lateral, Fowler's, shock position, anatomical planes, imaginary divisions that serve as reference points, sagittal and mid-sagittal, transverse or horizontal, midline, mid-axillary, and transverse. Y'all getting all that up there?
Yeah.
Huh?
Yeah.
Got any questions?
So,
No? Are y'all sad because Carrot Top is no longer with you?
Got a nickname.
Are you sad because your boyfriend left? Everybody jump at once.
you don't miss him.
You don't miss him?
And he's a traitor. He left us.
You did? Well, look at you. I mean, your britches. What happened to your knees?
I fell.
Yeah. Fell
Yeah.
onto a weed eater, look like.
Nah, I tripped a little bit.
You paid money for them britches?
Nah, my mama did.
I hope not. There's your direction. The regions of the body. Anterior chest, posterior chest. Lateral. Y'all getting all this?
Yeah.
What?
She's over here peeking, you know, just remember.
She's memorizing. Going through her body.
Memorized this already,
Yeah.
most of it. I'm a little rusty.
And everything in the left lower quadrant, don't look just at me.
Okay, left lower quadrant. So you've got your small intestine, large intestines, your ureter, fallopian tube for female. Oh, that's large. Ureter, fallopian tube. Your ovaries.
Getting
Here's Miss Poland.
That's the large intestines.
Oh, yeah, it is.
skeletal system, bony framework, ligaments and tendons, muscles and connective tissues. That's what sticks to all your bones and holds you together. Provides shape and protect organs, allows movement. Bless you again. You got one more. You gotta get it under control. You get 3 strikes. That's it. And you're out. Musculoskeletal system, the skeletal system, 6 basic components of the skeleton: skull, spinal column, thorax, pelvis, upper extremities, lower extremities. That's your skull, spinal column. That looks like a snake, no?
Kind of.
With a big ugly head on top of it. Musculoskeletal system, the skeletal system, thorax. Oh, you will be getting handouts later where you get to fill in the blanks. And it'll be a quiz. And if you get it right, it'll be 5, maybe 10 extra points. There's a whole lot to talk about this other than look at it. Joint motions, you have flexion and extension, abduction and abduction, circumduction, pronation, and supination. Or supination, however you want to pronounce it. Types of joints, you have ball and socket, hinged, pivot, gliding, saddle, and condyloid. Your hinge joints will be your what?
Your knee,
Knee, elbow,
elbow, wrist.
okay? About your ball and socket.
That's your shoulder,
What else?
your hips,
Your hips. Right?
um,
What about your fingers? What would they be?
would they be hinged?
Hinge.
Your phalanges.
Mm-hmm. I was literally about to say that you literally made me think of the movie or the show Bones.
What about pivot? Pivot joint.
I was gonna say, would that be your ankle?
Your head?
What's pivot?
It's, oh,
Think about it.
Be your shoulders?
Oh, doesn't it?
your neck.
Okay, you're getting there. What's
Remember
on
what
top-
pivot is.
What's on top of your neck?
Your
Your head.
cranial.
Remember your pivot. Left, right, left.
Okay, your cranial.
Got it?
What's a saddle joint?
No, we'll find out. What's a gliding joint? What would you think?
The only thing I can think of.
Carpal bones.
There you go, your hands and your feet. Okay, they glide. Saddle joint, what do you think it is?
I wanted to say your buttocks because it's saddle around you sitting on something.
I was about to say the same thing.
It's like inwards and up and down, so.
Ankle,
There you go.
down your knee,
Okay, what about condyloid? What do you think?
your toes, and your ankles.
What does this do?
Side to side.
Okay, so that would be what?
That's
And
Feet,
what else can you move side to side like that?
your hips,
Your head.
your head,
Oh, your head sits on. So your hands will do this. What else will do this?
your feet,
Your feet.
feet.
You all got it. I mean, it won't rotate. (360 degrees). You know, if it did that, we'd be out of here. Types of freely movable joints. Be your ball and socket, condyloid, your gliding joint, hinge joint, pivot joint, saddle joint. Bone injury. Bone is living tissue with a rich blood supply. Fractures can lead to bleeding from the bone or surrounding tissue. What's produced in the bone?
Your blood,
Bone marrow.
bone marrow, and your fatty tissue.
So what else does that produce? There you go. So do you think that'd be pretty vascular if you snapped one in half?
Mhm.
You'd bleed pretty good?
Yeah.
Bones have both arteries and veins. Vessels enter and exit through openings in the compact outer bone layers. They branch and extend throughout the marrow cavity and into the spongy bone at the ends. Because they are so richly supplied with blood vessels, bone can bleed profusely when fractured. So when y'all were practicing with the intraosseous needle, you drilled right into the bone marrow. That's why when you aspirate your syringe, you're pulling the bone marrow out so you can, one, either push IV fluids or two, medication through that into the bone marrow, which goes into the red blood cells, which goes everywhere else.
So that's why we were able to the other day in the lab, to put it down into the bone. You're showing us the paramedic.
Mhm.
We could aspirate and then put the saline. Okay,
Right.
that makes sense.
Tell me, is it clicking now?
Mhm.
Muscles allow movement by contracting in response to nerve impulses. 3 types of muscle. You have skeletal muscle, smooth muscle. You also have cardiac muscle. That's what they look like.
Kind of looks like a whole bunch of licorice.
Pretty much. That's in the cardiac muscle, the licorice got its tail. Same way with smooth muscle. Tom continues to manage the patient's airway and ventilation. Kevin is directed another EMT to apply direct pressure to the groin wound as he applies occlusive dressing to the chest wounds. One of the chest wounds is 2 centimeters inferior to the left clavicle. Where's that at?
Left clavicle inferior. So you've got the patient's left clavicle.
Mhm.
And so you're 2 centimeters inferior to it. So you're close to the midline.
Except you're on the right side.
Yeah, patient. Yeah, sorry. Shoot about that side.
There you go. You got it
You
right.
gotta turn around and look at the patient. Yeah.
The other is 4 centimeters inferior to the nipple line mid-axillary. Tell me where that's at. Somebody besides Haley. Play with your hair up there, talk.
This is the mid auxiliary.
Okay. One of the chest wounds is 2 centimeters inferior to the left clavicle in the mid-clavicular line, and the other is 4 centimeters inferior to the nipple line in the mid-axillary. So here, there you go, 4 centimeters down from inferior is what? Below? So it would probably be in the 5th, maybe 6th, between those ribs right there on the axillary side. That'd be about 4 centimeters.
Yeah, so still in your upper right abdominal quadrant?
Over here, but not down that far.
No?
Okay.
Nipple line? In the mid auxiliary. Okay, yeah.
But you get the general consensus of where it would be.
Yeah.
Oh, that would hurt.
Doesn't feel great. Wouldn't.
They can stab each other.
Well, it depends on what you're stabbed with.
Like.
You're stabbed with a nail from an air gun. What do you think that's gonna feel like?
Not great in general.
Sometimes you won't even feel it. there's a scar right here on my hand that runs from the bottom of my thumb up to here. And when I cut the tendons in my hand. I never felt it
That's great.
the whole time. Only time I felt it is when they dug up here in the upper part of my wrist to pull the tendons back down and sew them back together. Because my thumb was sitting here like this, it would not move whatsoever. The tendons were gone.
It's painful though.
Never did. Never did hurt. Even when I went to rehab. Right here. Right there. That's where they tied those tendons together. Feel it?
That's where you're going.
That's where the tendons are tied.
Oh, that's crazy.
Yeah.
So yeah, that stab wound's right here and right here.
That's like, I like taking them, it's about like this age. It's kind of crazy, kind of feel like not.
My brother kind of did
That's
something.
what it is. It's a knot where the tendons were tied together. They reached way up here to get
I
them.
was stabbed right here, right here. Yeah, it's like someone just went. So 2 centimeters inferior to the left clavicle and in the middle, mid-clavicular.
So, some stab wounds hurt and some stab wounds don't hurt. And it was only a knife blade that was this long.
That's.
And almost got my thumb off.
Ugh.
Okay, we found where the wounds were.
Yeah.
How can a stab wound to the chest impair ventilation and oxygenation?
Could have punctured the lung.
Get on it, Hayden.
Tension in the thorax.
Okay, how do you want to fix it?
You're gonna seal it up to try to stop the sucking chest wound if you can. Preferably, get them off that deflated lungs if you can, after you stop all the bleeding. Get your extreme bleeding out of the way, get that airway patent if you
Okay,
can.
let me ask you all this. If it is red oozing blood, what are you gonna do for it? Are you in a great big hurry? No. Now, if it is bright red, shooting, squirting blood, is that gonna bring your concern level up a notch?
Yes,
I hope so.
you're gonna slap some pressure on it, put a tourniquet on it if you can. If it's in a place, you can put a tourniquet on it. But if it's in the chest, you just slap. Because at that point, you're at a possible artery and they're gonna bleed out quickly.
Okay. How could applying an occlusive dressing over the chest wounds be beneficial to the patient?
Well,
You want me to let them answer? You want me to answer?
Get it, Hayden?
Okay, so occlusive dressing allows you to also apply direct pressure, which in sense, you can hold and stop the bleeding
Okay.
and keeps the red stuff. It's just the red stuff in.
Describe to me how you would put on an occlusive dressing.
it's a dress. That's a sticky one. Because it has to stick to the patient, so it keeps the red stuff in. But you put it over the wound, make sure you put it on its stickiness, so it would keep the blood in. 'Cause
Do
usually,
you want blood in your lungs?
well, no. I don't
Would it
know.
be to where, because it's a sucking chest wound and it's also leaking air, isn't that where the dressing is to where whenever they breathe, it like closes and then whenever they exhale, it opens?
And how would you accomplish that? You're on the right track. How do you fix that? I'm trying to put you on the spot. It's just you come up with it. Now you need to answer it. Now you need to solve the problem that you're working on. So the occlusive dressing does what?
Where it basically helps with their breathing, so that whenever they try to breathe, it doesn't let any
Okay,
of
let's
that.
break it down further than that. Occlusive, what does that mean? Covers the whole thing, don't it? Right? So, when you inhale, what do your lungs do? Expand. When you exhale, what do? They go back to deflation, right?
Positive pressure.
Okay, so if you put an occlusive dressing on and you seal up all four sides, what happens? You got four corners, right?
Mhm.
So if you just slap it on there and all four corners are sealed, how is that gonna work when you inhale?
It's
Okay, it's not. Now, if you fold one of these corners down, when you inhale, that corner will what? Think about it. When you breathe in, what is that corner of that?
it's gonna suck in
It's gonna,
suck
it's
in
going
the-
to close to where you can take a full breath, right? Now, if there's blood in the lungs and you exhale, what is that flap gonna do? What's the pressure gonna let it do? Gonna open back up so they can exhale properly, correct?
Yes.
Or next to properly. So when you inhale, it does what?
It holds.
It closes.
Yeah.
And when you exhale,
It-
it opens on its own. So Haley, when you put in a pressure on it, where do you put the pressure?
You put it over most of it, like to stop the bleeding.
Okay,
But at some point, you want to try to let it burp,
okay.
pretty much.
So when you exhale, it's what? It's burping.
Yes.
It opens. When you inhale, it shuts
Yes.
so you can get all the oxygen in through your mouth, down into your lungs. So if that flap was open or stuck open when you inhaled, what's it gonna do? Gonna suck, right? Because it's called a what? Sucking chest wound, right? So when you say occlusive dressing, that means you are going to occlude the hole, whatever has punctured it, right? So when you pull the flap back, that allows the patient to what? Somewhat breathe normally. So that flap is helping, is what it's doing. You're not gonna stop the bleeding.
But it's gonna allow their lungs to function
There you go.
semi-properly,
That's right.
get you more time.
So now you understand what an inclusive dressing is and how it works, right? It has stickies on all the way around it. Just
Unless you have
remember
a
that.
fancy one you showed us that first 2 days of class.
Just remember that when you put an occlusive dressing on, you seal the whole thing at first, and then you pull that flap back just a little bit. That way, when you inhale, it sucks. It sucks in. So you can fill your lung with air. When you exhale, if there's blood or stuff like that in there, then your CO2 will come out the flap, right?
What if you have neither, like neither of the, like the fancy one you showed and the one that you're talking about? Are you able to like make your own, what your resources are around you?
Sure, you got tape. You can make an inclusive dressing out of tape. Just tape it up, and pull the flap down on one side of it. So you can make like, you know how you make your deals for tic-tac-toe? Same thing.
Okay, so just.
All you do is you're filling in the blank spots with tape is what you're doing. You just need to make sure that you flop down one side of it.
Could you also do it with like a chip bag or something like that?
Sure. Why not? That's looking outside the box. I mean, I brought people in the ER with a tree stick tied to their arm with a 14 gauge needle sitting in their AC space because I didn't have a way to keep their arm straight. I reached over and grabbed me a tree limb. It works perfect. You know, Doc said, "Who put a tree on him?" Well, I did. His arm's straight, IV's holding. That's all that matters. Tree's not hurting nothing, is it? Respiratory system functions, respiration and ventilation, oxygen and blood and removal of carbon dioxide, assist with buffering of the acid-base balance in the body. You don't even want to go down the acid-base balance road. All you need to know that normal pH is 7.35 to 7.45. If it's below 7.35, you're acidotic. If it's above, you're alkaline. Okay?
You say that one more time. What was it?
What?
That whole thing.
Your acid-base balance, normal pH is 7.35 to 7.45.
7.45. You said that was acid.
If it is below 7.35, you are acidotic.
Yes.
If it is above 7.45, you are alkalonic. There's your respiratory system.
You said the acid base what?
Acid-base balance.
Balance, thank you.
Airway is divided into upper and lower portions, divided by the cricoid ring at the lower portion of the larynx. Respiratory systems are airway, the nose and the mouth, the pharynx, the nasopharynx, the oropharynx, and the laryngopharynx. That's all your upper airway. The larynx, the trachea, the bronchi, the bronchioles, and the alveoli are what? Lower. Respiratory system structures, the airway, the lungs, and the diaphragm. They are the organs of respiration, contain thousands of microscopic alveoli covered by pleural linings, diaphragmatic muscle. There's your picture. The upper and the lower airways. Now when I'm telling you about normal vessels and then how they are vasoconstricted and then how they are vasodilated, that's what it looks like. You give certain medications, you can constrict veins and you can also dilate veins with meds. Okay? So if you were to get hurt and you broke something and I had to give you, say, 4 milligrams of morphine. I start an IV on you. I would set the rate at TKO, which means to keep vein open. And I would give you 2 milligrams increments up to 4 milligrams. What that does is it dilates the vein and the artery so the blood can get through a little quicker. It also decreases your oxygen demand because your veins are dilated. So if you dilate, more blood can go through, right? If it's constricted, what happens then? Less blood goes through. So when you dilate arteries and veins, you decrease your heart demand for oxygen because your veins are dilated. So naturally, more red blood cells and more oxygen are going to be transported because they're dilated. When they are constricted, what happens? Exactly the opposite, right?
Yeah.
Not as much blood flow goes through.
You dilate it, you also have to watch for their blood pressure dropping, right?
Yes.
Yeah, because nitro will quickly
Yeah,
dilate.
it'll bottom your blood
Yeah,
pressure
yeah,
to zero.
You have to make sure they're actually having an MI, because you could kill someone if giving them
Not
nitro.
necessary.
Yeah,
But 9 times out of 10, if they're complaining of shortness of breath and chest pain and they have nitro and they've only taken 1, then you're allowed to give how many more with their medicine? 2. You can only give a total of 3. Okay, and they are 3 to 5 minutes apart on how you give them. So if you take your blood pressure, if it's 190 over 90, you give 1 nitro, you wait 5 minutes, take the blood pressure again. If they're still symptomatic and they have chest pain and they still have shortness of breath, you can give the second one, wait 3 to 5 minutes, take their blood pressure again. If they're still having these symptoms, you can give them that one last time. And then after that, you go to a different medication to get that blood pressure down, or to get the chest pain or the shortness of breath to go away. A lot of times, all you have to do is just turn the oxygen up. So you need to think inside your little box that you have this person has chest pain, has shortness of breath, and he's taking one of his own nitro. You get there, he's still symptomatic, he's still having all these problems. You give him another one. You wait 3 to 5 minutes, you take his blood pressure, and then if he's still having these problems, and his blood pressure can handle it, then you give him the third. Okay? Or you assist him with his medication. Oral lining of the lung. Y'all have heard me talk about pleurisy, right? And how painful it is. You get pneumonia, the visceral pleura, like it's kind of like putting WD-40 on a rusty nut. It sets, and this is rubbing the whole time, every single day, 24/7 that you're breathing. This is like grease to a tractor. Okay? When the grease gets dry due to dirt, due to water, due to all kinds of different things on a tractor. Your PTO shaft and things like that, they start making noise, don't they? Or they start this vibration, or they just don't look right. Once you grease it, everything starts working like it's supposed to, right?
Yeah.
So this swirl is sitting in between your skin and your ribs. So when you inhale, your ribs do what? Expand. When you exhale, they float back down to normal. So if you have pleurisy or the pleura is dry in there, when you inhale and your ribs expand, it hurts. Like you wouldn't believe because you're rubbing skin against ribs and you don't have the lubrication in between them. Does that make sense? So that's the pleural, the cerebral part of your deal here. There's your normal constricted bronchial and a normal one.
Is that kind of what happens when you get bronchitis?
Bronchitis, asthma, COPD, things like that.
Yeah. Looks like I just got all tight.
Yep.
And that's why you want to, for COPD.
That's why
patients,
they
you want,
have
like,
trouble
much
breathing.
oxygen to give them. Because you'll blow their lungs up.
No, it takes good hour to 2 hours, sometimes 3 hours with high flow to polish off the COPD.
That's, yeah, the way the image is, it looks like on the normal one with there's the blood vessels on top of it, right?
Yep.
The blood vessels, it looks like it just cause constricted, it looks like it just tightened it all up. It's all just trying to squeeze out, like a breathe.
That makes sense? Respiratory system anatomy and inference and children.
Yeah,
Everything on an infant and a child is more forward or anterior airways. Okay? Their oropharynx, nasopharynx, all that is pushed towards the front a little more until they develop into adults, and then it goes in its designated place
does look really small.
after they're grown up. Yeah, the inhalation, exhalation, diaphragm and intercostal muscles, we've kind of already went through that. When you inhale, the diaphragm what? Right? What does it do? Okay. When you exhale, goes back to normal. So inhalation, it rises. Exhalation, it goes back down. Oxygen and carbon dioxide are exchanged in the alveoli. Carbon dioxide and oxygen exchanges in the peripheral capillary beds. There you go. That's what it looks like. Adequate and inadequate breathing. Adequate defined as adequate tidal volume and respiratory rate. Adequate respiratory rate in adults. The average is 12 to 20. The elderly average is 12 to 22 breaths per minute. Children are 18 to 37. And infants are 30 to 60. Adequate and inadequate breathing. Adequate breathing of a regular rhythm, effortless, chest expands adequately, no abnormal sounds, and no use of accessory muscles. Inadequate breathing, rate is too fast or too slow, it is irregular, diminished or absent breath sounds, unequal or inadequate chest expansion, pale or blue skin, or mucous membrane, or agonal breathing, which means what? What do you think?
when they're not breathing properly, right?
One every once in a while, right?
Yeah, they're
Like
pretty
one every 10 or 12 seconds.
pretty much not breathing.
That would be considered active. Kevin's assessment of the patient's breathing reveals a respiratory rate of 30 per minute that are shallow. Breath sounds on the left side of the chest are diminished in comparison to those on the right side. So what do you think's going on there, Haley?
I'm sorry, I was right. What?
Pneumothorax, right?
Sure, I didn't hear you, I was right.
Okay.
Respiration 30. Yeah, tension
Okay.
pneumothorax.
Adequate or inadequate, the ventilation,
Inadequate,
okay?
because you've got uneven breath sounds from one side to the other.
How are these injuries affecting his body at a cellular level?
And not getting enough, well, with his lungs not being properly functioning correctly, it's less blood flow to them.
What else is going on?
You're not getting equal amounts of oxygen versus carbon dioxide.
Okay, what else?
Molecular.
Where are you losing?
You're losing blood.
There you go. Which leads to what?
Shock.
Hypovolemia,
Hypovolemia.
then leads to, there you go. Circulatory system, closed system, transport blood, nutrients, and oxygen to all tissues of the body, removes any waste products from the tissue, compromises the heart, blood vessels, and the blood. I can't see that very well.
Cardiovascular system, your heart, your veins, your capillary, and your arteries.
Circulatory system, basic anatomy of the heart, atrium, ventricles, cardiac valves, you have the tricuspid, bicuspid valve, pulmonic, and aortic valve. How would it be looking like? When you cut it in half.
That's crazy. And now it looks like stretched bubble gum.
Yep.
Fair enough.
Exactly what it looks like.
Yeah, fair enough.
Basic anatomy of the arteries, you have the aortic artery, coronary arteries, carotid arteries, femoral arteries, arteries of the arms and the legs. How long do you think it takes for somebody to bleed out if you hit one of these arteries?
Oh, like
2 to 5 minutes.
5 minutes.
yeah, I was gonna say 3. And isn't your aortic, the aortic,
They'll take 5 minutes. Need to go
get coffee?
and get coffee.
Wasn't required of EMT, but we had to learn the basic functions of how the heart works. So
Yeah, I have most of these diagrams in my midterm book. Colored for this back class.
see if I can.
Is your aortic artery the main artery?
So your aortic artery is the artery that's on the way out of the heart. So
Okay, and your coronary artery is the one where, that's when it gets clogged getting too much fatty food, right?
I think so.
I don't remember, that's a part. About to take 5 when I get done with the French.
So let me see if I get this down at the basic functions. So
I'm listening.
blood flows from the superior inferior vena cava into the right atrium down to the tricuspid valve into the right ventricle.
Okay.
I cannot remember this.
I won't get the.
It goes in through.
It's like this, that's not on your spell.
So bad. Read about it.
Yeah, it goes through the pulmonary valve,
Okay.
out through the pulmonary artery to the lungs, and it comes back in through the pulmonary veins into the left atrium, down to the bicuspid or mitral valve into the left atrium, out through the aortic valve into the aortic arch to the body.
Okay.
It's the pulmonary arteries and veins. It's the artery that goes to the lungs and the veins that go to the heart. Veins go to the heart, arteries go to the body.
Alright, I know how.
Yeah. And I remember that because it's the aortic artery that goes to the aortic arch to the body. So veins go to the heart, arteries go to the body.
Okay.
Good. And remember, whenever it comes to the heart, so when it comes to the tricuspid versus bicuspid valves, remember, try before you buy.
Right before you buy, and that's
So you're gonna go from the right side to the left side,
Okay.
so anatomical position. So it's gonna go superior, inferior vena cava into the right atrium, down to the tricuspid valve, into the right atrium, down into, again, that can be pulmonary valve, into the pulmonary veins, to the lungs, back into the pulmonary artery, the pulmonary veins, to the left atrium, down to the bicuspid or mitral valve. So remember, try before you buy.
okay.
Give me a second, I'll be in there.
Right.
What? Are you laughing? What I did. You sleep? Huh?
Yeah. Yeah,
100%.
Alex better not be asleep.
You like,
I guess I'll have to start bringing me a squirt gun.
had a problem.
One of them bazookas.
Well, the whole crossroom while you're at it.
No, I wouldn't do that.
You never know.
I don't do anything to anybody that I don't want done to me. Except my granddaughter when I throw her in the lake. But she asked for it.
Did she?
Yeah, she squirted me with a squirt gun.
She squirmed at you with those words.
I told her not to do it.
Yeah, honestly, I'm supposed to check on it. Yep. This is where it's found.
You will also get a little deal later that you will fill in the blanks. You also get a deal later that you have to follow a trace of blood through the heart.
And I know the basics of the heart, but some of this extra stuff like the interventricular septum.
Circulatory system, basic anatomy of capillary beds connect to the arterial and a venule site of gas exchange at the cellular level. So you think this is kind of like osmosis? Done. Circulatory system, basic anatomy is the venous system, venules, veins, vena cava, and pulmonary veins. What do all veins do? What do they get rid of?
Oxygen? No, carbon dioxide.
There you go.
Yes.
Carbon dioxide. They are the expulsions
They go to the heart.
of carbon dioxide. There's your comparison of the structures of the capillary vein. Veins also have a little valve in them that does not let the carbon dioxide go back down the vein because it only travels one way. That makes sense? Now for the fun part. Conduction system. Composition of the blood, red blood cells, white blood cells, platelets, and plasma. Mhm. Let me know when you're done.
Okay.
You don't have to hurry. Assessing the pulse and blood pressure gives information about the adequacy of circulation. The pulse is created by a wave of blood propelled by the contraction of the left ventricle. So if you can palpate a radial pulse, what do you think that your blood pressure would be at that time? Systolic wise.
At least over 90.
If you can palpate a radial pulse, it will be 70 or above.
Oh.
Okay, your first number that you hear. And it don't matter if it's hypovolemia, cardiac, or whatever. You have at least a 70 systolic blood pressure, so you've got something to work with, right? Physiology, the central pulses, the carotid, and the femoral. Peripheral pulses are the radial, brachial, posterior tibial, and the dorsalis pedis, which is where? Where's your radial?
Wrist.
And your brachial?
Arm.
Posterior tibial?
Like.
Back side of your what? Knee.
Yeah.
Okay. What about the dorsalis pedis?
Foot.
On top of your foot, right? Also remember that when y'all are checking SMCs, when you board somebody or you put them in the KD or you put them in the attraction split, once you palpate that pulse, if you'll put an X on it with your ink pen, you can go right back to it every single time and not have to feel around for it. Just put your finger on the X. And then that should be where your landmark is for the dorsalis pedis or the popliteal or any other artery that has a pulse. Unless you're starting IV on a horse, and then you have to feel it. The markers won't work. Blood pressure is the force exerted on the walls of the arteries that blood passes through. You have the systolic and your diastolic. Hydrostatic pressure is the force of fluid within the blood vessels and is determined by the volume of blood. Elevated hydrostatic pressure can be detrimental. There's your little picture. Physiology of circulation, perfusion, and hypoperfusion. Like a big wad of spaghetti to me.
Yeah, 2 pieces of garlic as the lungs.
That's it.
You got your little minced garlic in the bottom.
Well,
And top.
transport of gases in the blood, 90% of oxygen is carried and attached to the hemoglobin. 3% of oxygen is dissolved in the plasma. 70% of carbon dioxide is carried in plasma in the form of bicarb or bicarbonate. 23% of carbon dioxide is attached to the hemoglobin, and 7% of carbon dioxide is dissolved in the plasma. Transport of gases in the volume is cell metabolism. Aerobic metabolism is with oxygen. Anaerobic metabolism is without oxygen. Okay? Kevin completes his primary assessment. As Tom continues airway management, the assessing EMT continues to control the bleeding. They package the patient and load him into the ambulance for transport. During the assessment, Kevin notices again how pale the patient's skin is and that it is cool and clammy to the touch.
That mean he's not, does that mean he's plummeting, like he's going downhill?
Little crash going on here, you
Yeah.
think?
Like his body ain't keeping up because of all the injuries, due to the fact that the injuries, his body's crashing.
And this is why we do what?
Assessments.
Assessments, keep reassessing.
There you go, right there.
Keep reassessing.
Reassess.
Never reassessing.
Because you don't ever know when it's gonna change.
Yeah, the situation can change like that.
This cat's got a sucking chest wound, he's got multiple stab wounds, he's got a stab wound to the groin, he's got cuts on his forearms
You
and
can
his hands.
see, you can't diagnose, you could have internal bleeding, you can't see that.
So, that's right. So he could have a lacerated liver secondary to the stab wound. How much blood you reckon's in the liver? A crap ton.
Like if you don't do a thorough outside assessment, there could be one you've missed.
That's right.
You know, strip them and flip them, you never know.
There you go. It's too bad that we can't unzip them and look inside.
Be kind of creepy if we could
But
though.
if we could do that, we could fix it.
We could save. That'd actually be kind of cool.
If the bullfrog had 44, he wouldn't have to worry about rattlesnakes with it.
Yeah, that's true.
If. Would be cool.
Yeah.
Friday, I started an IV on the horse, right inside of his neck.
Interesting.
We put 10,000 cc's of fluid in.
Well, cow.
That's 10 1,000 milliliter bags of saline.
It's crazy.
Yeah.
Is the horse pregnant?
No.
I don't think it wasn't. It was just a question.
No, but
Can't ask, you never asked. me.
no, he was not.
Oh, it was a he, see, I didn't hear that part. It's.
He was.
What about the patient situation could explain his decreased level of consciousness? What do you think's going on with this cat?
Due to the injuries, he's not getting enough. His body can't keep up with his injuries, especially because, you got the one in the groin's close to your femoral. You're one to your heart, or the heart, the one on your chest. And it's like your chest wounds, therefore the fact that his lungs cannot keep up with his injuries because there's trauma to the body.
Okay, what else is he losing that's very, very important?
His blood,
Blood.
losing too much blood.
What significance did the patient's skin findings have for you guys?
The fact that
That he is what?
cold, clammy, pale, pale.
Pale. The skin is cool and clammy to the touch. So he is going into hypovolemic what? Shock. Because he cannot no longer maintain homeostasis. Because he's got holes in him and he's leaking.
Homeostasis is the key to keeping your body alive.
Look at you little smarty pants. Nervous system. Here we go. Controls and maintains a state of awareness, transmits sensory stimuli to the brain, controls voluntary and involuntary motor function, and controls body functions through the autonomic nervous system. Structural divisions of the nervous system, you have the central nervous system, which is the brain, and then you have the peripheral, which is what?
Extremities.
Everything else, right?
Yes.
There's you a big pretty picture of all that mess.
Your brain looks weird. If you see an actual human brain, looks like jello mixed with spaghetti noodles.
I've seen it. I had it in my hands before.
So weird. I've had a lamb's brain in my hands before.
Kind of stinks.
Kind of feels like jello though.
Kind of nasty. Like little kids when they shoot out the vagina at 100 miles. They look like lizards
Yeah, kind of look like aliens.
because they're all gray looking. They got this goofy looking stuff on them. You gotta wipe all that crap off and you gotta dry them all up and do all those nasty things.
Lovely baby.
About 5. Caught one time before it hit the floorboard of a pickup truck
Interesting.
at a car wash. They had stopped at a car wash, said, the baby's coming, the baby's coming. It was probably about 4.5 miles from my station. We got there, I opened the truck door, and here it comes. I caught it before it hit the floorboard.
Mommy, tell me about the day I was born.
Oh, you said sweetie, there was this nice paramedic man.
Walked into an apartment one time in the ghetto, and this lady was standing at the foot of her bed with her right leg up on the, like a, we put blankets in, we call them things.
Oh,
The storage box for blankets.
like the little chest thing.
Yeah, she had her right leg up on her chest, and here come his little head right out the hole. So I called him before he hit the floor.
Hope chest. That's what they're called. Hope chest. Yes.
He's standing up. But, gravity.
Back up. You said crackhead apartments, right?
Yeah, I said ghetto.
Ghetto, okay.
Ghetto.
No, you say same thing.
Oh, yeah, there's some crack in the ghetto too. I reckon.
How many different states have you worked in?
Louisiana, Mississippi, Tennessee, Arkansas, Missouri. I went to New York and worked COVID for, I think, 3 weeks. I was stationed in the Bronx Zoo. That was my base. I went to the Virgin Islands in St. Croix for 6 months. Worked down there. That was just like being in the ghetto again. Because it's lots of gangs and lots of drugs.
Interesting.
Worked multiple shootings. Nervous system, functional divisions of nervous system, voluntary nervous system, autonomic nervous system, sympathetic and parasympathetic. What do you think the parasympathetic nervous system does there? What you got? Looking at you. I don't care if you're wrong. I just want something to come out of your mouth.
Is it like a backup of like, say like,
What do you think happens in the parasympathetic nervous system? What's happening when you're sleeping?
body's relaxing?
Okay, but what's going on, do you think, in your guts?
Everything's just like going through and resetting itself.
Like an automatic, never-ending deal, right?
Mhm.
So when you eat, all your food goes into your stomach. Then it goes into the large intestines, the small intestines. Where do you get your nutrients from? What breaks down the nutrients? In your guts. Small intestine. Okay. So the sympathetic nervous system is while you sleep, while you are awake, while you are doing all the normal things that are happening as far as your breathing, your respiration. It's when you're sleeping, when you're awake. You know, when you're sleeping, it is slower. Go into REM sleep. But your stomach is still digesting food and your heart is still pumping blood and your lungs are still taking in oxygen and expelling CO2. So all this is going on while you're asleep. Well, that is your parasympathetic nervous system. All these things are still functioning. They just don't function at a rate that they do when you're awake. Now, your sympathetic nervous system is what they call your fight or flight. So if you're confronted with some old geezer that's out there checking his mail and you drive by his mailbox too fast and he starts raising hell and yelling and cussing and carrying on at you, you're either one, you're going to take off running like a scared little squirrel or a rabbit, or two, you're going to stand up and you're going to just give him the bully beatdown. So that's your sympathetic nervous system. So that is your instant response, your how you react, all that stuff going on up here and here. You're just awake and you're more receptive and twice as active because you are conscious and you know what's going on. In sleep, you know, you're flat out. Your body is at a kind of a rest state, but all this is still functioning like it is supposed to. So say like if you drank 4 glasses of water and come 1:30, 2:30 in the morning, your parasympathetic nervous system is working on all this, and all of a sudden your bladder fills up. Your bladder is gonna send signals up to your brain, say, hey, dodo bird, you drank all this water before you went to bed, now I need to pee. That help you figuring out the difference between the two? Yeah. Y'all get that?
Yeah.
Do you even care? That isn't answered.
What did you say?
I said, do you even care?
Do we even care?
Yeah,
We care.
okay. Just checking.
We care tons. We're like
Right.
so focused in.
Huh?
We're so focused in writing these notes.
Mhm.
Do you want your BS cards when you get here on Thursday, or do I need to mail it to you?
Show me my notes. I'm like 6 papers deep. Yeah.
How do I know that you're not scribbling some picture of some rooster up on a fence looking at a barn?
We'll bring you our notes. Yeah, I'll show you. I got front and back 4 papers full. So,
I'm glad that you are paying attention.
yeah.
We need a star student like you every single day. Okay?
Okay.
Alright. Moving on. There you go. Nervous system, it is consciousness and unconsciousness, relies on the cerebral hemispheres and reticular activating system, or RAS. RAS is a group of nerves in the brainstem. Unconsciousness results if the RAS or bot cerebral hemispheres are not functioning properly. Endocrine system. Oops, I'm sorry, Haley.
Was that her that made that noise?
Yes.
I thought it was like his chairs.
Listen, I'm the one being verbal about it, but you all needed it. I just copied off Haley. See, I'm not the only one. I'm being honest.
You good?
No, you been on this one. That one, please. Thank you.
Haley's being a little slow today, y'all. It's all Haley's fault.
Say that when you want my notes.
And you don't got much room to talk, sir.
You sleeping in class.
Well, he ain't slept in the last couple of classes.
Well, I can't say much because I've been counted.
He did have a book dropped on his desk though.
Okay, the endocrine system made up of thyroid glands and secrete hormones, regulate body function. Hormones affect numerous functions. The endocrine system, the endocrine glands are the pineal gland, thyroid and parathyroid, the adrenal glands, the gonads, which are either ovaries or testes, islets of Langerhans, pituitary gland, and the thymus gland. Pineal gland is small, located superior and posterior to the thalamus. The pineal gland produces hormone melatonin, which inhibits the functions of the reproductive system. The thyroid gland, which is in the anterior neck, regulates metabolism and growth and development and the activity of the nervous system. The parathyroid glands behind the thyroid produce a hormone necessary for the metabolism of calcium and phosphorus in the bones. The adrenal glands, which sit atop the kidneys, secrete epinephrine or adrenaline, and norepinephrine, postpone muscle fatigue, increase the storage of sugar, control kidney function, and regulate the metabolism of soluble water. The gonads, ovaries, and testes produce the hormones that govern reproduction and sex characteristics. The islets of Langerhans, which are in the pancreas, make insulin, which allows glucose sugar to enter. Got lost here. What was that?
You were on,
Thyroid.
No, the islets of Langerhans. Look up the Langerhans. That's the one you're on.
Oh, that's the Langerhans.
I'm not saying it out there.
You're not gonna see it.
Alright.
And pancreas makes glucose.
Yeah.
And then your adrenals, that's on your. Choose here.
There you go. Epinephrine and norepinephrine. Epinephrine is adrenaline. Norepinephrine are secreted by the adrenal gland. They produce many signs and symptoms of sympathetic nervous system stimulation. Epinephrine, known as the adrenaline, and norepinephrine. These hormones produce many of the signs and symptoms seen in the patients when the sympathetic nervous system is stimulated. To understand the signs and symptoms that are produced, you must first understand the basics of 4 effects. Alpha 1, alpha 2, beta 1, and beta 2 are activated by these hormones. Norepinephrine has mostly alpha 1 and alpha 2 properties, with lesser beta 1 and beta 2 properties. The primary effects of norepinephrine are on the blood vessels. That'll help you understand this a little bit better. There you go. The integumentary system separates the body from the outside of the environment. It functions, it protects the body, regulates the core temperature, serves as a receptor of external stimuli, aid in regulation of water and electrolytes. So basically what they're talking about is the what? Skin. It protects the body from the environment, bacteria, other foreign organisms, regulating body temperature, serving as a receptor for heat, cold, touch, pain, pressure, aiding in the regulation of water, electrolytes, and sodium chloride, or normal saline. Integumentary system, layers of the skin, you have the epidermis, the dermis, and subcutaneous. Now what they look like, that's where they are.
Looks like a casserole.
Pretty much. Pretty nasty. Especially I don't eat nothing got hair growing off of it.
Like I think of the yard.
The digestive system consists of the alimentary tract and use and accessory organs functions to ingest and allow absorption of nutrients and eliminates waste. Structures are the stomach, the pancreas, the liver, gallbladder, the spleen, small and large intestine, rectum, and the anus. Digestive process has 2 processes. mechanical and chemical digestion. Mechanical is what?
Here.
What you eat, right? Chemical is what your stomach breaks down, correct? The urinary renal system filters and excretes waste to maintain balance of water and other substances. Main structures are the kidneys, the ureters, urinary bladder, and the urethra. Reproductive system. The males, the sperm, and the females ovum contribute to genes that determine the hereditary characteristics of an offspring. A fertilized ovum grows into an embryo and then into a fetus, and finally a newborn lizard. They do.
They do.
You ever catch one out in the open, out land away from the hospital? They ugly,
No. I've only seen one.
slimy, they're bloody. They got this gray looking putty stuff on them. They're nasty. Huh?
Maybe.
They're nasty.
Yeah, but
Not all the time.
when they come out,
I have never caught a clean one.
You're not gonna catch a clean one. But not all of them are like ugly when they're born.
They all look the same when they come out.
most,
Yeah, they all look the same.
most
Like-
aliens.
No, they're just dirty.
They look like little aliens,
And most boys look like old men.
and there's not. You get in trouble if you take them to the car wash. You really get in trouble if you use the pink soap. So just dry them off and hand them to moms, and that, congratulations, it is your problem now.
It doesn't come with instructions, sorry. So, when the embryo is fertilized, the embryo, it's called an embryo until it gets a heartbeat, right? Or not heartbeat, until like, I don't remember. I lost my question, brain thought, never mind.
An embryo is an embryo. It don't matter if it's fertilized or if it's not fertilized. An embryo is an embryo. Now, when you are on your period, that embryo that is attached detaches and is expelled. Okay? So whether it's fertilized or not fertilized, it's still an embryo. Now, when it becomes fertilized, then you have a human,
Okay.
and it is attached to the uterus wall, and that's where the beginning of life process starts.
Okay.
Does that make more sense? What were you thinking?
I don't know, I remember reading something about, there's different weeks of pregnancies. It goes embryo, there's a week, one of the weeks per fetus. And there's like different sections throughout the pregnancy, what it's called.
See, but you produce an embryo
Devils, the frogs.
every so often, right?
Yes.
Depending on your, yes,
Yeah, Shark Week.
shortly.
Or as my
That's a good explanation for
My boyfriend calls me a ketchup packet.
it. Your boyfriend is an
He is.
idiot, because I know
I know your boyfriend too, and he's a friggin' idiot.
Sometimes
if he
I
had told me
question-
that, I'd hit him so hard he could stand on Wednesday and see both Sundays.
Oh, every time he calls me it, I slap the absolute shit out of him.
So,
Shark Week, it explains it so
My
much
boyfriend
better.
calls it the
Yes.
blood moon. And I don't know
does.
why.
Y'all are with boys.
Jesus.
that's a good way to term it, short. But, doesn't matter, you still produce an egg every so many cycles.
Okay, I was just like,
28 days.
Every
something like
month,
that.
every month, you're building a new egg.
Okay,
Because that's what God intended you to do.
Yep.
And that's how you function. Now, whether it's premenstrual bitchy shark week, or it's, I've seen people that would have to literally take off a solid week because their head hurt so bad during the menstrual cycle. I mean, I feel sorry for you guys. That says, what does it feel like to have a baby? And this woman told me you take your bottom lip, you pull it out, and you stretch it over the top of your head, and that's what it feels like when you have a baby.
Nicole, interesting.
So
Is that accurate?
Kinda. It felt like, I felt like my hips expanded outwards out of my body.
it's because they did.
That's how it felt. And it just felt like everything from here down just felt like it was just
An explosion.
Yeah.
Yeah. just felt like an
Do
explosion.
the splits on a crate of dynamite?
Yeah, it was literally, it felt like I was doing the splits. 100%.
On a crate of dynamite.
Yep. Well, that's exactly how it felt. That's a good description of it.
You could think
From
of
here,
it.
okay, no more next to that.
Alex, now you know what it feels like to have a baby. And get off your damn phone. Not gonna tell you again. Because if I have to tell you again, you're out. Male reproductive system. Female reproductive system. We've already gone through this. Each age group has specific emotional and physical characteristics that affect assessment and treatment. Pain is difficult to assess in most age groups. No, it is not. As caregivers, what typical reactions are for pediatric patients? When they hurt, you know. When they are very, 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 very sick, you know. Because I can take a sick child or a sick infant and I can stick them with a needle and they never even flinch. You come across that, you know that child is sick.
You don't want to quiet baby.
No, quiet babies are
Okay?
dangerous.
They're really scary.
Ain't nothing scary about it, you just do it.
So do we have a little baby dummy doll? Like practice on? We'll look at the. Like a little, like our adult one we have in there in the lab.
Mannequin.
Mannequin, thank you.
You got,
Little baby.
I don't know if it's a baby, I know there's a child.
Okay, interesting.
Anatomic and physiologic differences. The head, the airway, chest, lungs, respiratory system. Cardiovascular system, abdomen, the extremities, metabolic rate, skin and body surface area. Yeah, I told you they were good.
It's adorable.
Yeah. Geriatric anatomy and physiology. Age-related physiology changes begin around age 30. Well, that ain't no crap. People are living longer with chronic illnesses because we keep coming up with medications to keep these people alive longer.
Nicely selected words.
Yeah, because I was fixing to just let it rip. And I caught myself.
Great success.
Illness is coming among the geriatric, but not inevitable. Yeah, it's coming. It's common. The aging body has fewer reserves for acute, severe, rapid onset, medical, and traumatic emergencies. What is she doing up there? What are you doing, Sarah? Making a lot of noise. Cardiovascular system, stenosis of the heart valves can reduce blood flow and cause pulmonary edema. Cardiac hypertrophy can reduce cardiac output and affects the ability to compensate for illness and injury. There is a decreased ability to increase the heart rate to meet the demand. Why? Why do you think? Because it's aged and it's wore out. Okay? So do you think 85-year-old, 86-year-old dude that's been smoking for 53 years, what do you think his cardiac output's gonna be?
Oh, not good.
So is he gonna have like plaque in the arteries?
Yeah.
Probably have COPD.
What's gonna be in his
Yeah,
lungs?
oxygen, COPD, lungs can be plaque.
So now you get it? As far as old people?
Yeah, they're
Sometimes normal OT is probably gonna be around 94.
Well, I think it's kind of interesting with the geriatric age, when they get UTIs, they go, you know when they get a UTI because they either A, go completely depressed, or B, they go completely psychosomatic. There's never no in between. I'm not, but
They're from the bottom to the top of the scale.
yeah, because the ones I've seen are mainly gotten a little cuckoo or they have UTIs. And then they're fine.
Cardiovascular system dysrhythmias may occur and electrical conduction is impaired. Arteriosclerosis increases workload of the heart.
Say that 5 times fast.
Arteriosclerosis. That wasn't 5, but I'm done. Baroreceptors are less sensitive. Orthostatic hypotension may occur. What do you think orthostatic hypotension is?
Well, ortho is bones. Hypertension is when something.
Hypotension.
Hypo is
So, if you're laying in the bed and you jump up out of the bed and you stand up and you pass out, or you stand up and you get dizzy. So you're at one blood pressure and then all of a sudden you're up and you're upright and you're standing and all of a sudden you get dizzy. So your veins, arteries dilate, which gives you what? Hypotension versus hypertension, right?
yes.
So what you just did was you stood up too fast and your body will not compensate for your moving because you went too quickly. Respiratory system, decreased strength of respiratory muscles, decreased pliability of the rib cage, decreased alveolar surface area, and chemoreceptors become less sensitive. Decreased smooth muscle decreases airflow to the alveoli. Weakening of cough reflex and decreased function of the cilia increase the risk of infection. Did I go too fast, Ed? I'll put it back for you. Neurologic system, reflexes are slow, decreased ability to sense body position, diminished vision and hearing, decreased efficiency of autonomic functions. So, what do you think's going on here? They're geriatric. So they fall quicker. Right? They can't catch themselves.
Their motor skills are decreasing.
There you go. Sight changes. They have cataracts, glaucoma, macular degeneration, and retinal detachment. Neuropathy affects motor sensory and autonomic nerve attacks. Numbness, tingling, pain, swelling, weakness, and decreased pain perception may occur. Diabetes increases the risk of neuropathy. My mom has neuropathy. She can be walking along with her walker, and then all of a sudden her legs just quit working. What?
I don't know, it's
That's their
we're
bell.
passing a semi truck.
No, that's their bell. The high school has the same bell.
It's never been that loud before.
Like 10 minutes.
Or not the high school, the junior high has the same bell. The high school just does that little weird.
Yeah, I might have found out. I just heard the bell, I'm like, what is about it?
Yeah, the junior high does is the one that has high school.
I know, I just heard.
You know what, best thing to do in the press?
Don't think about this.
Listen, I'm catching the slack with slow riding, but I know it's everyone. Y'all hear me?
What?
I'm catching the slack for the slow riding, but I know it's everyone.
I'm your little toot toot toot, cause I just,
Oh, yeah, no, she's like trying to talk and
I'm literally trying to be the caboose and just express my brain. I'm being my ADHD brain today, so yeah, you're right faster.
ask questions, guys.
I'm asking questions so I can write down and I can be your caboose and copy her. That's my brain.
I'm
process.
gonna post
Are you
it.
trying to fool us into pushing?
I'm done. You wanna see what the notes is like, so?
Huh?
You wanna go?
But no, like today, I've just been.
Do you want anything? No, I'm gonna go after class. Cause I think we have lots of. No, he said take 10 minutes.
It looks like 10:15. I said 5 and I said 10 and I said 15.
Oh, I thought, I don't know. Listen, this is what today's notes look like already.
Well, the thing is, I have an AP class, so a lot of this I kind of already either know
Yeah.
or studying curriculum. Same.
Yeah, a lot of this I already know and remember. It's just,
Is this your only class or do you have?
Yeah.
Okay.
but I still work like overtime.
Yeah, no, that's what I was like, I was like, I don't know how you're doing that with like multiple, because you're doing multiple classes.
No,
It's an hour. There's only, like, I was gonna say, there's only so many hours in the day.
yeah, no.
She makes it
Hon-
48.
Honestly, I'm just trying to get my EMT. I already have a college degree. I'm not trying to
Well,
go or get another one, but
what's your college degree?
criminal justice. I came read about it back in from 2017 to 2019. Now, I signed up for the one that if I want to come back and actually get an EMS college degree, I can. I chose that program, but I'm just trying to get my EMT right now.
Are you paying for this just like out of pocket? or-
That's it.
Oh, nice.
I know, man.
Well, because my issues, I'm doing a bunch of prereqs
Mhm.
for paramedic. And that's like,
I don't know how some of y'all are taking 5, 6 classes on top of this one. I wouldn't want to do it.
I'm straight out of high school, so my mom's letting me, like, I'm trying to get a job currently, but they're just letting me stay there while.
Yeah, that would be the only way I could say it, because
Oh, trust me, I don't think I could, if I had to work like you do, and you're trying to pay bills and then also do all that.
oh yeah,
I
so
live with my.
so
family.
I live by my onesie, so all bills I cover. And so Mondays and Wednesdays I work 2 to 10:30, and then Tuesdays, Thursdays, and Fridays I work 4 to 12:30 in the evening,
Well, like,
and then on call 24/7.
sounds so fun.
Part of being supervisor. And then, on off times I run calls. What's fire for?
Go to school, go to my day.
I miss going to the gym. I don't have the time anymore.
I mean, you're always running around, so I mean, I guess,
Yeah, that's not weight training,
yeah, weight training is nice.
Yeah, I can't tell you what my squats probably diminished to.
Well, like, I love the gym. I would hate to have to give it up.
If I had to give it up, just gonna go run and
Well, I go walking almost every night, so there's that.
Well, like the schooling thing, you have to give it up some days. But I live all the way in Norfolk, so it's like a 20-minute drive every single time.
I live in Potter. So, well, it's the middle point because I work in Yale.
You're flipping. I'll be honest, because all the from the fire department.
Yeah, but I'm on that department. I'm trying to get moved into that district, but like I'm right there. I'm like a minute across from the bridge, which once you hit the bridge to go into Marion County, that's the flipping fire district.
How'd you start? Oh, my bad.
Okay.
How'd you start like all this fire department and like get your EMT stuff? Cause like
Um,
I hear you talk about it and you're like so confident and stuff. I'm like, dang, I'm like so far behind compared to her.
So, I worked on the flipping police department. Is how I got introduced to them because I was on the road there. And I just got really good friends with the fire department. Like, we just got along and I was talking to chief one day and I'm like, how do I get in the fire department? He's like, put an application in. So I did, and they put on an EMR class. And I took the EMR and I passed. Which we took that over a series of like 4 or 5 months. We had 5-hour classes
Okay.
twice a month.
Or
That's
just
not bad.
more compared to this so far.
This is harder. This is more expensive. So EMR is like the basics, like you're not allowed to do near as much. And so again, a lot of
Yeah,
it,
just more.
EMT is EMR, just with a little extra.
Okay.
That's why I know a lot of this already. Cause I've been there, done that. Like, the pre-test for this chapter got a 96% off. Cause I already know the basics.
To be honest, I'm so behind on those just because like the first week I couldn't even get into it.
Yeah.
And then like,
Actually, we weren't even here.
Well, she extended,
You
extended the due dates a lot
Well,
of them to
and
October
then-
15th.
my stuff like broke. I couldn't even get past. I was stuck on the chapter 2.
Yeah.
Like that's how far back I was.
Did you email her?
Like I just now finally got it fixed. So I have to get caught up on like 6 chapters.
So advice when you're having technical problems that are not your fault, like I had that happen, first thing I did was email her.
I did, but the thing was, I had to wait till a day to come in here to finally get her to like answer what I was trying to do. She even said she looked at my email. She just didn't answer it.
Yeah.
I'm
Well,
like, I don't.
hit her up at class, come early, stay late, like I
Yeah. Well, I'm just gonna when I get home because I was gonna go to the gym today, but I think I might just skip and just work on school.
and that's the thing, you're gonna have to give and take, like,
Well, that
two each their own what you can handle. I was up till 3 o'clock last night working on this.
well the really this class isn't my hardest class. It's A and AP.
Yeah, A and P will
The
be
one
hard.
that's kind of kicking my ass right now.
Yeah, A and P will be, because you're doing this, but in depth.
Yeah, well, luckily, it's not AP1. Luckily, it's just like they have certain ones. It's AP1 and 2, and then
Yeah.
AP for health professions.
Yeah.
So like AP for health professions, just like a
The
speed-
basics.
I think like more of like a basic run of it.
Mhm.
I would hate to do AP1. I really hope I don't have to.
Yeah.
But I might have to if I do para.
Yeah. Yeah, I wouldn't want to do all that on top of this. I'm just here to get not my paramedic, my EMT for now.
Well, the thing is, because once I get my EMT though, I'll have a job.
Yeah.
But with all, I don't want to have to like go into paramedic school and it's like, oh, I got to do all these prereqs on top of whatever I'm working.
Yeah.
That would suck. I'd rather just go and get them done while I'm living at home and then.
Right. Well, and that's why, eventually when we get another full-time position open at our fire department, I want to transfer and go over to that because our assistant chief, he is getting his paramedic. Our fire department is very, lenient on, hey, we're gonna help you with this.
Well,
If I eventually want to go get my paramedic, they will help me.
I'm thinking of doing paramedic first, and I kind of want to go over to the fire department.
Do it, do it.
Because that's my grandpa was a firefighter. My whole family's been in like medical/firefighting.
Yeah.
Every single person in my family has.
So there's a difference between career, volunteers, and combination departments. So like living in Norfolk, it's a volunteer only. You won't have a career.
Yeah, no, I'd have to move.
Yeah, so Mountain Home is a career department. Flipping's a combination. There's not a whole lot of them around here that are a career or combination. Most of them are just volunteers. So you would just have to look into it.
Yeah, I'll probably either thinking of after I get all of my stuff done, either just moving here to Mountain Home
Mhm.
or just going somewhere else completely.
Yeah.
Because like he was saying with our what is it called? The next semester, we're gonna, we'll be in, we'll be.
You know what I'm sensing? I wish you would
Watching
picture-
stuff.
Wait, was there like?
Yeah, like, if he's leaving sex.
Yeah.
So we're not gonna be.
Beginning?
Yeah, he was on the walkies. Check the bullet card, run around the, is that the thing? I gotta go to Arkansas, I'll take the next one. It's good, because I thought it was gonna be 4.5 hours. But now the West Plains one. I saw your picture. Did you see the toddler? I did.
The one in Bakersfield's never really that good.
Well, I've been there, I've been going there my whole life.
You're safe.
You just have.
But look, I went to the one in West Plains. So we had to wait
Haley, I'm
an
gonna steal
hour.
your chair from you.
Oh, I went to the one in West Plains.
So went to the cornfield in the woods.
Yeah, I don't want to see Bloody Timber.
That was,
Yeah.
that one I really enjoyed.
Sleepless hours.
It was fun tonight. My boyfriend was with us, right? And he kept hiding in the corn mazes, all kinds of shit. Look how happy she is. I tell you, she has no fear.
Hey, man, I was in the
Bakersfield, my house was
started
scared.
on the college, like I started.
No, she's,
Yeah,
she's
that's not that scary. I don't go to that one just because I know everybody there.
it's like, it wasn't scary.
Regular, like.
And the cop that, now the cop that's little friend, West Point.
Yeah.
Where he was like, are you interested in my house? She was, yeah, I went to Bakersfield. It wasn't even scary.
Function.
I think your daughter's old.
ADHD and,
People love
big, like, hyper anxiety to people please and, very self-deprecating
I was just.
and caffeine, lots of.
I was gonna say, I'm guessing.
It's just like the beans.
Pretty much,
Just
no,
smoke
I
the
was
coffee.
really bad at NC then, and again.
Well,
not-
yeah, do you realize?
So, you know, there were.
So many.
Is he the
How do you say the last name?
Sepulveda.
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 Yes.
Oh, I like that.
Yeah, no, when I was out there, I didn't need to sleep.
So do you know?
Did not need to sleep.
Well,
I get 8 hours of sleep and I'm still tired.
Yeah, easy. I would probably get maybe another hour before I get a lunch for another 8.5 hours.
Or this year.
I can function off.
I graduated last year.
I'm not gonna say I'm functioning right now, because I'm not sure if you've seen it.
There you guys go.
See the entire class, but this also just because this is everything I've already.
Hey,
done.
wait,
It's not like I don't-
My.
Well, don't, you're not
It's like I'm speaking.
Do something you love.
You just put your hand on it and try
Well,
to.
I didn't realize this part moved, so then I.
And this stuff really
Do what?
intrigues me.
Yeah,
This
Mom-
stuff I like because it's.
Things you did it
thing to
too.
Work at.
I don't want to hear this in there.
Kind of comedic. And
Whitney.
that's not me trying to sound pompous or.
No,
like
no,
that.
it's fine.
So this stuff I struggle with sometimes and
Whitney.
Literally made
you're literally learning how to make someone.
shoulders, knees, and
Say,
toes.
don't feel like that.
No.
Head, shoulders, knees and toes, knees and toes.
Like when I do, like shots
Something like that.
No.
Shoulders,
knees, and toes,
please. Classes. I don't function very well.
Take
I
the key check.
also think this is
love
my,
it.
I don't know why, but I'm trying to find
So I only have one key on that there, and I got it straight. So pink. It's strawberry kiwi.
It looks like bubble
This
gum.
is my favorite.
That went bed at 12 and I woke up at 3 and I couldn't fall back asleep and I'm like,
Like
that.
Something you're gonna have to train your brain is to be dead asleep, to be able to respond adequately and start learning how to function on here and stuff like this. Yeah, you showed me that one. What's the neatest one? Here's this bad job. I wanna start putting out.
I'll go to bed
Wake up.
because sometimes I just don't wake up.
You'll learn.
I guess
You'll
your
learn.
body treats the.
Yeah, you'll learn how to, like for example,
Oh,
you know,
he
my,
dead
my,
Freaking dead stared me in the eyes, and I was like, I'm walking out.
Is my phone call alarm, because again, I'm on call 24/7. With my job. I've adapted the ways to make sure I wake up. That wakes me up because the first thing that.
I didn't pay.
I got training this week. Training of Friday for the fire department.
Well, no, that's not
Because
necessarily.
I was avoiding-
You can't get to sleep. You'll learn to, like, certain tones will just hit your ear and you're like, and that just comes with time.
Okay.
So he is the one from last time.
Yeah, I just got.
I didn't
one
pay
where I
attention
can
to
sleep
anybody
well,
today except for.
But when I do,
He
Yeah,
took our order.
like normal
Yeah.
sounds,
I'm fine with, fans.
I went on Friday, but I went to the Kobo one on Friday, right?
Little
before.
house. I know people went fucking stuck.
Yeah.
There wasn't many actors. And when the actor said,
It wasn't good.
no, because we were second to last to go through.
What'd you guys go?
Some aspects,
Saturday.
sleeper, some aspects.
And we were the second to last to go, and let me tell you, my boyfriend, he went in front of us and right in the corner.
It's just gotten that way.
Okay, and my mom, she was like, creeper, creeper, the whole
I mean,
cornfield,
hopefully I
mom stopped the corn.
I
Mom stopped the
when I
corn.
was,
We were in the woods, and she jumped down the first hole,
I.
and I was like, mom, that freaking tree,
Yeah.
no person.
Sorry, my sleep.
Well, then there's that one where you go through, it's past the church, and you go to another section of someone with a dark room with laser light. With a black tunnel at the end,
Yeah.
and my boyfriend just stopped there, like one
That's
accident.
what I was like, I'm
Stop.
thinking,
My sister
Again, here's my time.
Friday and Saturday night, my plan.
College.
My Friday night,
I don't remember a lot from the age of like.
They have an
19.
She's like there for 50
I didn't
minutes.
like
She's
it. I did not.
there for 15
Freaking-
minutes and. Yeah, we could put the-
Absolutely,
Yeah.
yeah.
Told me I'm gonna change.
Yeah.
And then go out again.
Booked it. Flying it. My feet were not, right.
Yeah.
Fell.
You see
And
people.
he felt so bad because he scared me and I fell there. Like, I'm good, I'm good.
Barely
Yeah.
know.
Shit.
When did this start?
Hmm?
Was it August?
What? Yeah. Yeah, August
Oh,
17th.
yeah.
Drunk people always think that's.
Yeah, especially when you started
I
off.
started, what,
Yeah, I know, that's like.
Christmas parties are great. There was this
I like past maybe, but like, just go like this.
It's.
Yeah.
I don't know if they would believe that.
Just stuff for all like a junior high girl. No, there was this
Started
one,
on the 8th.
they'd always
Started off
schedule
Friday.
a Christmas party.
Started on Thursday.
And, you know,
Started on-
me and 3 other bartenders, we'd all at least walk away with $400 cash tips that
I
night,
added it
at least.
to college.
I worked at a,
Mm.
for summer for a while. They mostly tip you when you like clean their fish and stuff. And
Pizza
it
sandwich.
was always like, it was always best. I always knew you could give me a tip when a drunk guy was walking up to me offering me a beer or something like that. I'm like,
We're gonna enjoy the, we're gonna enjoy the ride
how
home.
many fish I clean.
Just
And
enjoy the
I
ride.
didn't walk away with 400 or anything, but there was one week where I walked away with about 200.
There you go.
You're like,
There you go. And the 400 was like only like Christmas party rare occasion, and it's like we get all the tips and we spend that anyway when we're parties even.
Yeah,
I'm gonna
well,
take out.
it was
My
funny though.
parents are.
Every single time they offer me a drink, I'm not of age. So it's like,
Speaking of which, if you.
they just say thank you, but I'm like, thanks. And then I hand it over to my coworker. My coworker loved me for it, so I just handed him it.
They're
There you
big.
go.
And he was always like, thanks, appreciate it. I'm like, I need to, even if I have options.
What your dad's having.
Hesitant to use me.
Yeah.
And like, I've,
Cause they're in the
like, I
same
know why some
ballpark.
people do it, I just don't.
And then if you go to this app, here,
That's not- that's
Too
doing
good.
fine.
not on here.
I do it in moderation now.
I
kinda
have
got-
3 groups on here.
You know, I'll go home, especially if I'm
This is
rotating.
mine and my boyfriend's group. That's where he's
Yeah,
at.
so I completely understand why some people do it.
There's a little
Like
church
personal.
school.
Yeah, no,
A little church school.
Until it actually gets up, they don't become an alcoholic.
They're at the school.
As long as that's like part of it.
you gotta have advice somehow.
Click here, you get my mom and my sister.
Okay, y'all ready?
They're going 59 miles an hour.
I tried talking.
You should hear that.
Sarah?
We're ready.
Oh, they talking now? Okay, whatever.
Everything go. I
Yeah.
guess I just didn't want to talk to you.
Yeah, man, I don't know. It's
They said they don't like you.
I know, because I left school
Oh,
and I did cheer up there and they're like, oh, you left and now you can't do cheer and stuff up there. And I'm like,
Hey,
You're here.
that's what I'm doing. They're upset because I can't do it up there. No.
well, guess what? We're doing finger battles. You guys think hey, stuff in the basket. Now we're doing a basket.
It just sounds like a bunch of gibberish.
And then
I saw that. I have a video
Almost here.
and we did one up at,
What is going on?
cheers. I think.
yeah.
Like,
They said they did a
cheers,
basket.
I think.
That's when they make like a little square. And I'm behind as I throw them up.
Back to head, shoulders, knees and toes, knees and toes.
Simon says no.
Okay, now that we're done talking about cheerleaders, whatever it is we're talking about. gastrointestinal system, deterioration, smell and taste, loss of teeth, decreased salivation, and changes in the stomach and esophagus can lead to malnutrition. In other words, if you don't eat, you don't get little. Liver disease, the liver decreases in size, weight, and function. Peristalsis throughout the GI tract is slowed. What do you think peristalsis is?
That like the movement and
Of the what?
movement and function
Of the what?
of your intestines, like your small intestine, your large intestine,
Okay, which nervous system are we looking for?
the P1.
Parasympathetic. Okay,
I love how you just called it the P1.
P1. Endocrine system, there is an increased risk of type 2 diabetes. There's less efficient regulation of blood pressure, fluid balance, electrolyte balance, and beta sympathetic response. Decreased thyroid hormone decreases metabolic rate. So if your thyroid is decreased, you have what? Hypothyroidism, right? The musculoskeletal system in the geriatric anatomy and physiology increases osteoporosis, weakens the bones, loss of vertebral disc space with kyphosis. What is kyphosis, Keely?
What's kyphosis? Oh, osis is, abnormal condition. Loss of vertebrae disc with.
Kyphosis is this.
Oh, it's where your spinal curves where you're hunched over.
There you go.
Oh, yeah.
Little hunchback.
One of your family members have it?
His dad.
Yeah, my stepdad.
Yeah.
That's what reminded me of it, because I was like, your stepdad has that. That's how I knew what you were talking about.
Degeneration of joints, decreased range of motion, decreased skeletal muscle mass. Renal system. Nephron loss with decrease in kidney mass, decreased renal blood flow and filtration rate, disturbances in fluid and electrolyte balance, decreased clearance of drugs may result in toxicity. In old folks, metabolism slows down, correct?
Yes.
So if you're taking medication, how long do you think the process of that breakdown of the medication takes to get
At least in times
to
longer.
the target cells? Takes a little while because your metabolism has dropped, right? Integumentary system, the skin is thinner, looser, more prone to injury, and wounds heal slowly. See all this on my arms?
Yeah.
As I have become older, if I bump my arm or if I use my arm or press against something with my arm, my skin will bruise. So the wounds healing slower means metabolism isn't functioning as properly as it should. Medical terminology, specialized language used in all fields of medicine, complex words can be simplified with an understanding of combining forms, suffixes, and prefixes. Hypo, below normal, hyper, above normal, without means no. Tachy is fast, brady is slow. Are y'all figure out the rest of it? Having time to begin transporting the patient to the hospital 30 minutes away and requested that a paramedic intercept en route, as well as notifying the hospital of the patient's condition. Upon reaching the hospital, surgeons immediately took the patient to the operating room where they spent several hours repairing damage to the patient's liver, lung, femoral vein, and several blood vessels in the chest. So did Haley fix this cat? Did she kill him?
Fixed him.
She did the best she could.
She could get into the
So
hospital.
what she had to work with, right?
Yep.
Knowledge of anatomy and physiology helps with understanding patients' signs and symptoms and the treatments of the EMTs provide. And anatomical terms and planes provide points of reference for describing assessment findings. Both geriatric and pediatric populations have physiological differences that are important to understand. Medical terms make up the specialized language shared by healthcare professionals. Y'all got all that?
Yep.
There you go.
You can sue us for taking.
What time does y'all's bell ring?
45, but we can get out anytime. But we can,
45.
whenever you're done, we're done.
Whenever they finish, they usually go up to the nurse's office because that's where the CNA class is at, so they'll hang out with the nurse and do their CNA work up there.
Fancy, fancy. It's selling y'all out.
Brown Hope does it at the college.
She's selling y'all out.
Okay, that is the lesson for today.
Okay.
Y'all stay there and do your notes and do all the things that you need to do. And your bell rings, you go to whatever class you go to next. Where's Misty at?
I'm reading the finding.
Yeah. Tell her Scrap said hi, and y'all have a good day. Can you behave yourselves till the bell
I gave you a
rings?
new name.
Do what?
Can you behave till the bell rings?
6.
We're probably just gonna go to the nurse's office.
Okay. Y'all have a good day.
You
Bye-bye.
See y'all Thursday.
too.